CNA Diabetic Foot Temperature Testing. Welcome to the quiz. Question 1. A resident who is usually very calm and oriented suddenly becomes confused, aggressive, and sees things that aren't there. This happened shortly after they started a new medication. What could this be a sign of? Option A. They need more attention and one-on-one interaction to calm down. Option B. An acute onset of delirium, possibly caused by the new medication or a UTI. This is a medical emergency. You must report this sudden change in condition to the nurse immediately. Option C. They are just having a bad day due to being tired or stressed. Option D. A normal, rapid progression of undiagnosed dementia. The answer is B. Sudden onset of confusion, delirium, is a medical emergency. Option A is incorrect because attention won't fix the underlying cause. Option B is correct because sudden onset of confusion, delirium, is a medical emergency often caused by medication, infection, or other acute issues. Option C is incorrect because it's not just a bad day. Option D is incorrect because dementia progresses slowly. Question 2. When making an unoccupied bed, what is the purpose of folding the soiled linen into a square bundle as you remove it? Option A. To contain the soiled linen and prevent the spread of microorganisms and contaminants to yourself, the clean linen, or the environment. Option B. To count the number of linens being used for inventory purposes. Option C. To make it easier to carry the linen to the hamper without dragging it on the floor. Option D. To save time during the bed-making process. The answer is A. Infection control is the primary reason for containing soiled linen. Option A is correct because infection control is the primary reason. Option B is not accurate. Option C is a benefit but not primary. Option D is not primary. Question 3. A resident tells you they are in pain. What is your role and responsibility as a CNA? Option A. Go to the medication cart and get them a PRN pain pill from their drawer. Option B. Assess the pain on a scale of 1 to 10 and then decide based on the number if they need medication. Option C. Listen to their complaint, offer comfort measures like repositioning, a back rub, or a warm blanket, and report the complaint promptly and accurately to the nurse, including the location, intensity, if they can rate it, and any observations you made. Option D. Tell them the doctor has to order pain medication, so they will have to wait until the nurse comes back with it. The answer is C. CNAs can provide comfort and must report pain to the nurse. Option A is incorrect because CNAs cannot administer meds. Option B is incorrect because assessment and decision are nurses' role. Option C is correct because CNAs can provide comfort and must report pain to the nurse for assessment and medication. Option D is incorrect because it dismisses the complaint and doesn't offer comfort. Remember, we can take your CNA exam for you, remotely and undetected, and with 85% score guaranteed, no fails, no upfront fees, no deposit, pay only after results. Message us via number in bio to schedule your session. Question 4. You are feeding a resident and they begin to choke. They are conscious, but cannot speak, cough, or breathe. What is the next step? Option A. Leave them to go get the nurse or call for help. Option B. Perform the Heimlich maneuver, abdominal thrusts, immediately until the object is expelled or they become unconscious. Option C. Continue offering them small sips of water to help wash down the food. Option D. Slap them on the back several times to try to dislodge the object. The answer is B. The Heimlich maneuver is the standard for conscious choking victim with complete obstruction. Option A is incorrect because leaving is unsafe. Option B is correct because the Heimlich is the standard for conscious choking victim with complete obstruction. Option C is incorrect because water can worsen obstruction. Option D is incorrect because back slaps are for infants. For adults, abdominal thrusts are used. Question 5. Which of the following is a violation of a resident's right to privacy and confidentiality? Option A. Discussing a resident's care plan and needs during the shift report in the private nurse's station with other staff members. Option B. Talking about a resident's personal and embarrassing behaviors with your friends in the cafeteria during your break, using the resident's name. Option C. Posting a resident's daily schedule and care preferences, e.g., prefers shower in AM on a small whiteboard in their room for staff reference. Option D. Telling the oncoming CNA during report that a resident was incontinent twice during your shift. The answer is B. Sharing personal information with non-staff in a public place violates privacy. Option A is part of professional report and is acceptable. Option B is correct because sharing personal information with non-staff in a public place violates privacy. Option C is acceptable for staff communication in the room. Option D is part of professional report and is acceptable. Question 6. A resident with expressive aphasia, difficulty speaking, is trying to tell you something and is becoming frustrated. What can you do to help facilitate communication? Option A. Remain calm, give them your full attention and plenty of time, ask simple yes/no questions, and encourage them to point, use gestures, or use a communication board. Reassure them that it's okay and there's no rush. Option B. Tell them to slow down and speak clearly so you can understand. Option C. Finish their sentences for them to save time and reduce their frustration. Option D. Walk away and come back later when they are calmer and less frustrated. The answer is A. Patience and alternative communication methods reduce frustration. Option A is correct because it reduces frustration by being patient and using alternative methods. Option B is incorrect because they may not be able to control their speech. Option C is incorrect because finishing sentences can be frustrating and inaccurate. Option D is incorrect because leaving avoids the issue. Great job! Don't forget to subscribe. Bye.